Yep. Well, good morning, all. And you should be seeing a sort of dark green blue screen that says post-polio syndrome changing symptoms. And that's what Jill asked me to talk about today. She also asked me to do a little review for some of you who may be new to this whole process. So let's go. So first, a quick review. Post-polio syndrome, or PPS, can happen in about 40 or 50% of polio survivors. By definition, it happens at least 15 years after the initial polio illness, but it can have its onset 50 or more years after the polio illness. It's what we call a diagnosis of exclusion, which means that you have to eliminate in theory, everything else that could be causing the symptoms before you conclude that post-polio is the cause. There's no test, and generally that's true for anything that's called a syndrome. Syndrome means a collection of symptoms or signs, but there's not a definitive test. So it's not like you can have an EKG that shows you've had a heart attack, or you can have a throat culture that shows you have strep. Or blood sugar that shows you have diabetes. So it's sort of eliminating all of the, and generally it's all of the more common causes, other causes of whatever your symptoms are, because it's just not practical to eliminate every possibility. That would cost thousands of dollars and take probably a couple of years. So the symptoms, signs of post-polio syndrome are one or more of the following. And people can have just one, they can have two, they can have three, or sort of any combination. Increasing muscle weakness, and usually that's in the muscles that were previously affected, but it can be in muscles that were thought to not been affected. For example, if your left leg was totally paralyzed, but the polio actually affected some of the muscles in your right thumb, but to a lesser degree, and it really wasn't functionally a problem, that may not have been noticed. You know, it's sort of like you forget about your headache when you hit your thumb with the hammer. You don't really notice the headache anymore, at least for a little while. Pain in muscles or joints, we call that musculoskeletal pain. Most often people describe it as more of an overuse or soreness type pain, but not always. And people who are old enough to remember when they had polio frequently will say that it feels similar to their initial polio. I am a lumper. I include things like if you have developed wear and tear arthritis in your good knee, since that knee has done the work of 1.5 or 2 knees for most of your life, I include that as part of post-polio syndrome, but not all people do. And then thirdly is unexplained fatigue, and that either can be muscular fatigue, so the muscle just feels like mush and isn't going to let you do take one more step, do one more repetition of whatever you were doing. Or it can be generalized, just bad case of the blahs, and some people describe it as hitting the polio wall.
Hey Marny, I'm going to try a view option that will put you side by side here.
Okay.
Now, are you guys able? Can you nod if you can see Marny next to the screen, or is that my view option? I think it's what, Margaret?
I have the screen, the screen across the top, the view of everybody, not beside.
Okay, thank you.
Okay, and the usual course of post-polio syndrome is that it's usually a slow progression. One study that looked at decrease in muscle strength because that's really the only thing we can measure. We can't really measure somebody's fatigue or somebody's pain. So objectively, the only thing you can really measure is muscle strength. And this study showed an average rate of decrease in muscle strength of about 1% per year. 1% is not enough that most of us would notice it. So it frequently is accumulation of like over 4 or 5 years or over 10 years, when now it's 5% or 10% decrease. That's enough that you may notice it. Some people have a sudden onset or worsening after some significant trauma or illness. But what seems to be sudden may not be quite as sudden as it seems. Frequently, a polio survivor will tell me that, oh, this came on right after Thanksgiving, but their family member says, no, we've been seeing little signs for longer than that. Also, remember when you first realized you needed reading glasses? You know, there was a day that suddenly you said, darn it all, I have to go get reading glasses. But it didn't happen overnight. It had been happening for a long time, and finally your ability to compensate just didn't work anymore. Your arms weren't long enough to hold the newspaper out there where you could see it. I want to remind everybody, you've been more than your polio, and you still are. You've had your career, your family, your successes, your failures. You've walked when the doctors thought you would never be able to do so. You married even though your parents feared you never would. And you've had children, raised families, had careers. But life has also happened. You've had accidents, injuries, developed new diseases, and then, of course, that ugly aging factor. So very few of us are pure cases of our polio anymore. And just because you had polio doesn't mean that you can't get other diseases and ailments. So when symptoms change, the question gets to be, is it polio related or is it something else? And the evaluation when you've had a significant symptom change may need to be similar to the initial determination if indeed your symptoms were due to post-polio. Before we go any further, some of the symptoms, and these primarily are not, these in fact all are not related to polio, but are just that, the other things that can happen. Don't delay in getting emergent evaluation if you have bleeding that can't be controlled or is from your GI tract. That's like vomiting blood, vomiting stuff that looks like coffee grounds, because the coffee grounds is old blood, and passing blood in your stool, or even black tarry stools that we call melena. Those are all signs of bleeding somewhere in your gut. Significant shortness of breath, especially if it's new. Signs of a possible stroke. And people use these various initials to sort of just help remember the symptoms. So FAST means there's been a change in somebody's face. They may be drooping on one side. If you ask them to, if they were able to before and you now ask them to bring their arms up in front of them, one of the arms doesn't come up as high as the other, or it comes up and then it starts slowly drifting down. S is for speech. If they're just talking in gibberish, or their words are slurred, and that's not usual for them. And then T is time. Just like with a heart attack, when we say minutes are muscle, heart muscle, with a stroke, time, the sooner someone can get to the hospital and have treatment initiated, the less damage there'll be. So this is a time to not say, well, gee, they're going to think I'm just a hypochondriac or whatever. It's a time to have things checked out, because if you wait an hour or two to see if it really is going to get better, and sometimes it does with the TIA, you may have lost a lot of potential function. The EFAS is, the E is for eye, if there's a sudden change in vision, and then the face, arm, speech. And BFAST, the B is for balance. Some strokes happen in the back part of the brain and affect your coordination or balance, or can also cause a sudden onset of severe dizziness. And then the rest is eyes, face, arm, speech, and time. Obviously, chest pain that would be concerning for having a heart attack or maybe a pulmonary embolus, a blood clot in your lung, and the sudden loss of vision. And then symptoms that require urgent evaluation, which means, in the next week or so, unexplained weight loss. If suddenly in a month you've lost 20 pounds and you really think you've been eating about the same and haven't had vomiting or diarrhea. Your skin or eyeballs turning yellow, jaundice, which indicates a problem primarily with the liver. New pain that can't be controlled with your usual measures, especially if severe or unexplained, although if it's severe, you probably won't be willing to wait a week. A new lump or mass anywhere, such as a breast, because certainly a number of polio survivors I've seen have developed breast cancer. Sudden onset or rapid changes in your ability to move, and sudden loss of control of bowels or bladder. So the challenge gets to be that each of these major symptoms can be associated with each of the major symptoms that are associated with PPS, so the muscle weakness, the musculoskeletal pain, and the fatigue, all have many causes other than polio. And there was, about 6 months ago, there was an article in our American Family Physician Journal talking about muscle weakness in adults. And these next two slides are from all of the possible things they list in that. And in fact, I was sort of disappointed that they didn't list post-polio syndrome as one of the symptoms, but one of the possible diagnoses. But so neurologic can be any like ALS, which is commonly known as Lou Gehrig disease, a lesion in the brain, a stroke, hemorrhage, a mass like a tumor, a problem along a nerve, anywhere along the nerve. So things like carpal tunnel, Guillain-Barré syndrome, which is in a lot of ways looks like polio, except that it's usually symmetrical. It means that whatever is happening in your left leg also is happening in your right leg, or your left arm and your right arm. Where polio is usually asymmetric, usually it's different in each of the limbs, but not always. Multiple sclerosis, myasthenia gravis, a spinal cord lesion, and others. And then there's about 4 or 5 muscle inflammatory conditions, and some involve muscle and skin. Endocrine problems, either too much or too little of thyroid hormone, adrenal hormones, parathyroid hormones. Some genetic conditions, and we usually think about muscular dystrophy as occurring in kids, but some of them have onset later in life, in the 40s and 50s, usually not into the 70s. Some medications can cause a muscle weakness, and probably the most notable are either the steroids like prednisone, particularly high doses and for long periods of time, the statins used for cholesterol in some people, and that actually can happen both in people who didn't have polio and people that did have polio. In my experience, it's not been any more common in people that had polio than people who didn't. But obviously, if you already have some weakness from your polio and now you get some weakness on top of that from a medication, it's a little more significant. And one of the antibiotics, the fluoroquinolones, probably the most common brand name is Levaquin. Excess alcohol can cause muscle weakness. And then catabolic, which means basically that your body is starting to destroy or take nutrients from your muscles to help with your nutrition. So in cases of malnutrition, like the little old lady that just drinks tea and her whole diet is tea and toast. Or if then for fatigue, if you Google the causes of unexplained fatigue in adults, you'll get a number of sources, but one that I think is pretty reliable is the mayoclinic.org lists 25 conditions or the drugs that are used to treat them that can cause fatigue. And I've just listed them there. I'll hit the highlights. Problems with your liver, problems with your kidneys, anemia, anxiety disorders or depression, thyroid problems, cancers, chronic infection or inflammation, concussion or other traumatic brain injury, lung diseases such as COPD, diabetes, fibromyalgia, grief, some inflammatory bowel diseases, and then medications, pain medicines, tranquilizers, allergy medicines, chemotherapy, obesity, multiple sclerosis, persistent pain, because having pain all the time really wears you down, untreated sleep apnea, and stress. So my view, the more common of these conditions and those that would be treated differently should be ruled out. I mean, obviously, if your fatigue is from uncontrolled diabetes, telling you to pace your activities and to take rest periods is not going to help. You know, you need medication or diet control, whatever. And in fact, it could be dangerous just taking rest periods when the problem is diabetes. And a lot of these can't, sort of all together can be ruled out with a blood test. So fortunately, the list of potential causes of musculoskeletal pain is smaller. It includes certainly the obvious. If you have pain in your joints or your muscles after you have spaded up the garden in the spring, which is an activity you hadn't been doing, or when you're raking the leaves in the fall, again, an activity that you don't usually do, it's not unusual you're going to have some muscle discomfort. And if you've turned your ankle and sprained your ankle, I mean, it's sort of obvious why your ankle might hurt. There are other things, fibromyalgia, and some people feel that polio survivors have a little higher incidence of fibromyalgia than the general population. Various forms of arthritis. And again, some of the forms of arthritis, the wear and tear arthritis, is pretty common in polio survivors, particularly in the unaffected limb or the lesser affected limb that you've overused, or in long-term crutch users or long-term manual wheelchair pushers. They sort of wear their shoulders out because God didn't really design shoulders to be used that way. We all have friends that are similar ages that have certainly had pinched nerves in their back, and that can cause the musculoskeletal pain. And actually, if the nerve's pinched enough, it also can cause weakness because the message isn't getting out there to the nerve. Some of the autoimmune disorders like lupus, gout, and gout doesn't just affect the big toe, it can affect any joint. Infection of the skin, joint, or bones, and then some various tumors. So in medicine, we have what we call pearls. And pearls are sort of truths that can be summarized in a sentence or two. So we're not talking about the jewelry that I've shown at the top of this slide, but one of them that I found a number of polio survivors aren't aware of is in hip pain. If the pain is coming from the joint, as in you cracked your hip, maybe not completely broke it, or if you broke it, although if you broke it, you probably can't stand on it. But if it's coming from the joint, the pain is nearly always felt in the groin. It's not felt out on the side of your thigh or in your back, in your lower back on one side. And it's a challenge because people mean so many different things about their hip when they say hip pain. But if it's in your groin, then, and particularly you had an injury, it's a time to think about getting an x-ray to make sure that you didn't crack or have a small fracture in your hip. Secondly, tripping and falling is rarely due to being clumsy or lazy. You know, people that have foot drop will say, well, you know, I tripped because I didn't pick my foot up high enough. Well, that's true, but you shouldn't need to have to pick it up that high. So your body wants to stay upright and wants to prevent you from falling. So if falling is a problem, you need to have somebody look at the cause with you. And frequently there are devices and other solutions that can help if the problem can't be cured. If your foot drop isn't something that's going to go away in a week or two, and there are a few weird that will cause a temporary foot drop, but most of the time it's going to be permanent. And then particularly for safety, look at what can help rather than it just being a matter of your will and you thinking and remembering all the time to pick your foot up. And then lastly, for polio survivors on the pearls, use of aids is not giving up or giving in. You know, I know some of our rehab was that if you just work hard enough, you can get rid of those braces, crutches, canes, whatever. But frequently thinking about using it and doing it can actually give you more independence and decrease fatigue, pain, and the falls. So try not to be so proud that you really are limiting yourself. And then my final advice, just think safety. Again, fall prevention and reduction, because as we get older, our bones are more brittle. We don't bounce as well. And it can be, particularly if you break the hip on your good side, it really can be limiting. Thinking about, are you safe driving? And be really honest about that. You know, it's not only your life, but the other people out there on the road. And I know, I mean, certainly driving is a big deal in terms of our independence, but at least for me, I would feel terrible if I killed somebody when I could have done something differently. And something I don't think people always think about is, can you get out of your home in an emergency? And you pretty much, you know, ideally that should be, can you get out of your home independently? Because if there's a fire, people may not always be able to help you before they help themselves. And then think about saving your shoulders. You know, we in polio with weakness of lower extremities, people frequently use some canes, crutches, manual wheelchairs, etc. But if your shoulders are shot, you'll need to be lifted on and off the toilet and in out of bed and help to dress. So try to reserve enough function of your shoulders to last for a lifetime of doing those important things. And that's my last admonition. And now I'll open it to questions